This program is presented by University of California Television. Like what you learn? Visit our website or follow us on Facebook and Twitter to keep up with the latest UCTV programs.
Thank you for braving the rain. Thank you for the rain. And joining us tonight, we are pleased to have Dr. Barbara Bennet, who is the medical director of the California Pacific Medical Center Child Development Center. She's a clinical professor of pediatrics at UCSF and a developmental pediatrician in private practice in Marin. She's going to share with us tonight her advice and observations and findings on early identification of autism and referral advice. Dr. Bennet.
Yes, thank you. So I'm very happy to be here with you tonight. Actually, I'd just like to point out to you in the lower right-hand side, there's a little logo. It's not mine. It's actually part of autism and the puzzle of autism and how there are many different phases of autism. So I have been in this field for a very long time, and about 15 years ago, I started noticing that I was seeing more children who had autism. Prior to that time, it was pretty unusual to see kids with autism, and it has seemingly increased every year. I was concerned enough at that point. I had a friend at the Center for Disease Control and actually contacted him, and I said, you know, I'm in clinical practice and I can tell you something's changed, and it was actually the beginning of all the increase. So this is a journey for everyone, and this year when I heard the statistics, I have to tell you I started crying because I don't want this to keep happening, and nobody else does either, and I would really like for us to have a very simple test that we could determine whether this is autism or not. Right now we don't have it. Lots of people are working on it, lots of research is happening, but for now we have a pretty difficult kind of time getting diagnostic stuff done. So what's my focus is I really like seeing very young children. I like older kids too, but I really like very young kids. And a lot of people in my field don't like seeing young children much, but I happen to like it. And so this is my way of telling you that there are some signs that we can see pretty early in infants, actually. They're not totally diagnostic, meaning if you see a baby and they have some of these signs, don't go, oh no. It is a sign, it doesn't mean it's happened. So I just tell you, I don't have any disclosures. And I think this really describes autism from my perspective. Always unique, totally interesting, sometimes mysterious. And this is the DREAD slide showing statistics. And you can see that in the 70s, 1 in 1,000, and this, well, it's actually 2010, it's 1 in 68. And so that kind of increase, everybody says why. I don't have all the answers, neither does anyone else, but I have some ideas and some information from research. So 2014, what is autism? And you can see on the left-hand part, 1 in 68 children now are being, well, this is 2010, diagnosed with autism. It's 1 of 42 boys and 1 of 189 girls. And this statistic holds pretty steady for many statistics with neurodevelopmental disabilities. The cost of this, aside, this is money cost, but I would tell you the cost of this issue is a huge burden for everyone. It's up to $3.2 million for a child. It can be more than that. It's billions of dollars for the country. And what if we could do early intervention? Let's say we can't even prevent this issue, but we could do something early where we might not actually see autism. We might change the picture. So for me, it isn't really the cost. That is very important, because there are some studies now showing that there are some programs available that really make a difference, and children who may be diagnosed with autism actually, whether they overcome it, I don't like grow out of it, but their behaviors change to the point where they are no longer diagnosed as autism. And the earlier that happens, the better that you start intervention. So what is it? Basically, it's kind of a triad of issues. It involves communication, it involves social interaction, it involves interests. And you have to have all three. So you can have problems with communication, but if you don't have the other issues, it's not a problem. I would tell you some children have primary communication issues, many times have issues with social interaction with their peers because they can't speak well, but then it becomes a secondary problem and not autism. So what's communication? Absent, delayed, disordered language without an attempt to compensate nonverbally. So I'm up here, I'm using my hands, I'm trying to look at you. And I'm using nonverbal behaviors, facial expressions. They're things that are kind of, most of us don't think twice about. But having those abilities, meaning you don't have speech. I see children who have no speech. They cannot talk, but they can communicate very well. They can use sign, they can use a communication device. So this is more than just speech. It's also communication nonverbally. And I'll go through some of the nonverbal signs. Sometimes children have had words and may lose them, or they may use them once and never use them again. One of the patterns of autism actually can be regression. You can also see stereotypical or repetitive language. So children who don't use words will come in and recite an entire Disney video. So clearly, they can use words, but not with the intent to communicate. It's for their own interest. Many children, echolalia, meaning repeating what someone says, is actually a normal developmental milestone in early childhood. But this is when I say something, and the child says, when I say something. So it's exactly what you said, it's not turned around at all. And it's not developmentally based. So, what's social referencing? And you need to figure out what somebody else is telling you, verbally, non-verbally. You have to read it, and you have to interpret, and then react appropriately. One of the things that happens is, does a child respond to their name? And I would tell you, no child ever responds to their name all the time. But if this is pretty consistent that you say the name and you keep doing it and you go louder and louder, I mean, it's not the only reason children do this, but it's one of the signs, response to name. And again, it comes back to this theory of mind. It's understanding that other people have a different perspective than you and reacting to it. And it's also not imitating much. Imitation is very important for learning, and I think this is actually why when you work with children early with autism and they start getting imitation skills, they do much better because they also learn much better. Children with autism rarely imitate. And it puts them behind in terms of learning, and it puts them behind in terms of other ways. And then reciprocity is the back and forth of a relationship. So these are all words. I know they're kind of not very, it's kind of like ethereal in a way, but I'm going to show you actually pictures of some of this in infancy, actually. Just to tell you, so what are the interests that children can have? A lot of children get into very repetitive, restricted interests. You know, Thomas, engines, it's not a bad thing, but when it is all-consuming and that's the only thing you do, it's kind of concerning. So repetitive motor movements, this alone, so remember, these are things that can happen. It does not diagnose autism. There's spinning, kids love to spin. There's also pacing. Kids do this a lot, walking back and forth. Their interests can be letters, numbers, open, closed doors, lights. A lot of this, they're very visually oriented. It's actually a really good strength that children with autism have, is they have very nice visual interest and understanding. And actually, if you've read anything about Temple Grandin, who is a woman with autism who has a PhD in veterinary science, one of her books is about thinking in pictures. She has this ability that probably not many of us have, to be able to visualize everything exactly. I went to a conference where she presented at lunch, and she said, first she told us we couldn't eat because we were making a lot of noise, and that's good because she recognized that could be distracting. But here's a woman who is a brilliant woman, PhD in veterinary science, and she wanted to explain to us why words didn't mean much to her. And it was a very compelling kind of thing for me. So she showed pictures of dogs. And she said the only way I could see that these were dogs was they had a long nose. And then she put up a pug. And she said, I have no idea why you call that a dog. And it isn't lack of knowledge or intelligence or anything else. It's that words don't mean a lot. The visual piece does mean a lot. Patterns of play, getting into the same type of play all the time, and not much imaginative, symbolic, or pretend play. And there's other things that can happen with this, but some children, just small things get changed. And you don't even know what got changed, and they get very upset, and they can't tell you what's going on. So causes of autism. That's there, it's not a mistake. Well, if you're with children who may have autism, and you look around, first of all, you notice how cute they all are. I have very cute kids. But the other thing you'd notice is they're all a little different, much like we're all a little different. But they may have more of one thing than another child. Some children really get into letters, numbers, etc. Other kids have other interests, others are flapping. Lots of different kinds of, but there's this common triad. So this is a simplistic version of what probably is causing autism. So you can say genetics. Well, did our genes change in a generation? Which is really what we're talking. No, probably not. But what did change? We're actually able to identify more things that can occur in genetics now because we have such a sophisticated way of looking at genetics. So if you had the genetics alone and you didn't have the risk, you probably would not have autism. But when you look at this bubble of risk, you could probably say anything to me that happened during pregnancy, and I'd say, oh yeah, that's a risk. It is if babies are born too close together, babies are born if there's 5 years apart, that's a risk. It's almost like living is a risk for autism, quite honestly. So that's a problem because you can't protect against all these things. You can't say, well, I'm not going to have babies, I'm going to have them at 3 years because that's exactly where they should be. Well, that may not protect some other risk that's out there. So environmental, demographic changes. One of the interesting things is that it is maternal age is a risk, but so is paternal age. Not only paternal age, but paternal parents' age at time of conception. So because we're the ones bearing children, it's a lot of stuff looked at us, but there are other factors in here. So this just tells you very complex. There's lots of information known, but right now, it's not all in. Just to talk a little bit more about genetics and the brain and autism. Sometimes autism actually is associated with other kind of neurodevelopmental issues. It can be with Down syndrome. It can be with some other ones called tuberous sclerosis, neurofibromatosis. So there's other, it happens more commonly in these disorders than in the general population. So people are looking at that and saying, well, what is happening there that's causing this more? And actually now we have some evidence that there are some sites, very tiny sites in genetics, and they're being identified as autism-susceptible genes. And there's already some information that these autism-susceptible genes have some phenotype, meaning children may be more at risk for having seizures if they have that chromosomal change. So this actually, I think, is going to give us more information about children and what may be going on, but it's still very much in the beginning parts of understanding this. And, you know, eventually, I do think, first of all, we're going to have some way to diagnose this more easily than now. And I do think we're going to be figuring out more treatments. So Fragile X is a chromosomal issue, and many children with Fragile X have autism, like 50%. So it's been looked at partly as a model. The folks at Mind Institute at UC Davis, it's been looked at as a possible model for, well, if we can help these kids, they kind of have a propensity towards it. With some meds or some changes, maybe it will work for autism. So this is being researched a lot. Now, if you look at children with autism, only 3 to 5% of children with autism have Fragile X. So it's not a big group of children, but could it give us some information about the brain or something that's going on that we could make changes? So this is telling you there's copy number variants, all these hundreds of, so what you do is you take hundreds to thousands and put it together with thousands to hundreds of thousands in risk, and that is why I think we see some different things within autism, different symptoms to some degree, and I think we'll be able to tell that better. Risk, I talked about this. Low folate levels in mother and conception, and it just goes, the last part is really the most pertinent, on and on. I put some few things in here that are risk associations. So having this as a risk doesn't mean you'll have a child with autism. But these, and it literally goes on and on. So lots of factors out there. We know some meds, we know extreme prematurity, we know some stuff about environment. There's always tons of information in the paper about this has been found, and all these kinds of things that people are finding are associations, but they are only associations and are not the only cause. So what is happening? This was a study I particularly liked. Now, it's a very small number of children, babies and stuff. It's 10 or 11, which really, if you look at research, this is not totally valid. There needs to be more studies in this. They found changes in 10 of 11 of these children. That's statistically significant. And then they looked at other kids, and only one of the unaffected had this. So probably there is a connection. There was an article recently about inflammation in the brain as the cause for autism. That's one of the more recent things. And that actually is maybe what is happening, why there's brain inflammation, whether this is an autoimmune phenomenon or something else people haven't identified. So what are the changes they saw in these babies? They had patches of abnormal kinds of findings in places called the neocortex. And this is the part that's formed between 19 and 30 months. These are the parts of the brain that are most associated with social and communication function. So this may be a hint of what's happening. And if it is, I would say a lot of the evidence is saying that this is probably in process before birth. Why do we screen? I'm here to talk about screening for why do it. I think you probably already figured out why we want to screen, because if we could intervene and change the natural course of this and help parents and children, wouldn't that be great? So it's common. We still don't have this lab test, so if you could have the lab test during pregnancy or something, then you don't you would be screening early, or you might screen before pregnancy. I would tell you there's implications for family planning. So for a family that has a child with autism, if they have more children, they have an increased risk compared to the general population of having another child with autism or some kind of developmental issue. So what has happened, though, and I'll tell you that parents, well, everybody today is very aware of autism. I have not met a parent who said, what are you talking about, autism? It's pervasive in everything. And the other part is, I think a lot of us know someone with autism. Do any of you guys know someone with autism, or no? Yes, one, yeah. And so families actually have real children in front of them to see, and families are concerned. I would tell you that parents probably have concerns in this world before 18 months, many of them. And it still is that the mean age of diagnosis is 3 to 4 years. And that's the problem. Part of the problem is the number of kids coming up and who's doing the diagnosing and how can you get them into services. And obviously, some groups don't have good access to care. So it is an issue. And also, diagnosing autism before 18 to 24 months is very, very hard. 18 months it can be done. 24 months for sure can be done. But before then, you really don't diagnose autism generally. I've had one child or a couple of children at 12 months that was very specific, and it was pretty clear that was what was going on, but that's unusual. So early intervention works. That's why. So people can get in and get intervention. You can have an optimal outcome. Because this is a very behaviorally based diagnosis, behaviors change over time. So this is optimal outcome. There is a medical code for this. It's called autism recovery with residual. So yeah, so there is such a thing now. It's actually been around for a long time. I personally see this happen a lot, which is what keeps me going. To see how much children improve or can improve, and it is something that keeps you going. Optimal outcome means to me, so parents will say, well, he does this and he does this, and I have a kind of simple version of how I look at whether something's a problem in life or not. If it doesn't get in your way or someone else's, it's not a problem. And really, if it doesn't get in your way, it really is not. We're all different people, so if it doesn't impair you in some way, why bother, unless you want to? When babies and children are very young, you actually can kind of do rewiring of your brain. And what happens is, actually within autism, it's been found that between neurons, there's a time when there's blooming of these connections. Lots and lots of connections, trying to figure out which ones are going to be the best. So this blooming happens. And in autism, I would tell you, probably happens sometimes more than typical children. That's part of the reason why head circumference in the first year of life can increase more than you might expect. But the blooming stops and the pruning starts, meaning you get rid of things you don't use much. So the connections you haven't used much, your body automatically kind of makes them go away. Now, if they're very good functional connections, you don't want those gone. And you can actually get kids to kind of use, and it's shown on PET scans and everything else. So there is evidence that we can actually make brain changes. And this is a very simplistic version of something. Intervention may help. This is the rewiring that I talked about. And it's kind of, but you can actually see the one on the left versus the one on the right. That's very simplistic version of something more complex. So this is my talk. What are red flags? Well, basically, red flags don't mean that a child has autism. I want to make sure that people know this because, somebody, oh, my child's flapping his hands. And I'm like, yeah? I mean, if that's all the child's doing, doesn't mean much to me. But it can point out something that maybe is going to develop. So I tell you what happened is because we know that children with autism have their parents have a higher rate of maybe having a child with autism. They've actually done a sibling study across the United States. So they've watched siblings of children with autism from practically birth all the way through. And they looked for common signs that they might see within these babies that could tell them something's going on that might be of concern. So it's perspective. It's not looking back, it's looking forward. And so they looked at this, and a lot of what I'm going to talk about is a result of this SIB study. And it's very interesting, and I think it's very important. And the families, really, I have many of my families who are having other children, or I tell them go there because that way their child can be followed, and if they are showing symptoms, they can kind of get them and do something. So what can a red flag mean? First of all, I would tell you, it can be normal. Maybe the child's just delayed. It doesn't mean you have autism if you have speech delay or other kinds of issues, so you may be delayed. You may have regulatory issues. So what are regulatory issues? This is if you kind of state control, so you want to be relaxed, alert, et cetera, and you get into a room and the light's shining in your eyes, and you get all discombobulated. Well, and for children, they can't go, they could, but they probably won't. And I think we all have kind of sensory kinds of issues. I know I have a lot of them. I can choose what I wear, what I do a lot, but kids can't choose this. So sometimes kids look like they're disconnected, but they're really just overwhelmed. It can be just communication issues. I would tell you if you have chronic medical issues, a lot of times kids can get withdrawn when you have there's lots of stuff that goes on where parents are concerned. You could think, well, oh, they have, and I've actually seen some children with very, very significant medical issues, and people are saying, well, could he have autism? I'm like, no, it's because of what's happened to him and his family. Maybe normal, and of course you can have combination of all of the above. So maybe it's a warning sign, and this is a study I talked about that is in process still. But you can still see some of the things I'm going to show you as normal. And I keep emphasizing this because I don't want you to leave here and see a child who has head, leg, and go, oh my God, it's autism. I don't want that to happen. And you can be delayed. And really what they are, they're related to the triad of the issues that we see within autism. So now finally I'm getting to them. So what do we have? No big smiles or joyful expression by 5 months. And if you're around very young children, this is something that you see babies doing lots. And babies, they're pretty amazing, even very early. I have a 4-month-old grandson, and I was actually going to show you videos of him. My daughter was okay with it, but they imitate. You do an expression, they imitate your mouth. They can have a conversation with you back and forth. It's just kind of amazing. It happens very early. So this is one of the concerns, that if it's not happening by 9 months and they're not sick or something else has happened, the family isn't in turmoil for whatever reason, no babbling by 12 months. So babbling is a consonant and a vowel. Cooing is vowel. So it's babies initially go, ooh, ah, ah. Babbling is da, da, ba, ba, that kind of stuff. And usually babies under a year really are doing lots of this, especially if they're in their crib by themselves, you hear them, blah, 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 and the crib going away. 3-point gaze. So this is using your eyes and someone else's eyes to say something. And if I was to look at the exit sign, look there, and look back, I'd be telling you, look at that, with my eyes only. And this is something that is an issue that's a big sign of something may be going on, unless there's some other medical reason for it. So I'm going to talk about pointing, how important a point is. Showing, like a child has something and goes, or giving. Waving, hi, bye, usually they do bye, not so much hi. By 12 months, eye contact is another one. That's something that a lot of people know could be part of autism. And it isn't the parents will say, oh, when I'm scolding him, he's not looking at me. Well, of course he's not. He doesn't want to get in trouble. That's a different kind of eye contact issue. That's not an issue. That's normal. So what are other things? No words by 16 months. So usually kids have mama, dada. 24 months, usually 2 words, want milk, without a prompt or repeat. And I put that in there because parents will tell me, oh, he says want milk. So I'm with them and they go, want milk? And prompt. And they don't know they're doing it because they're good parents, you know. Any loss of speech or babbling or social skills at any age is concerning unless there is an underlying reason that you can identify. And we talk about the back and forth. So this is what I like to do, is show you pictures. If you have children, you've been around them, you kind of know this. But it makes you think about how we communicate. Here's all the things that are happening in this one picture. Here's this boy and girl, and the girl's got the body language, and he's there looking at her, and he's kind of gesturing, like, want to work with this with me, and he's saying something to her, and I don't see a lot of pointing. And there's inflection in voice. That's the other part sometimes that can happen with autism. Sometimes the intonation of what children say is a little bit different. So these are all nonverbal communication that you should see in very young children. And if you didn't know what a big smile or joyful expression was, I, of course, went crazy over this. This is so much fun to find these pictures. It makes me smile when I look at it. It's just like, isn't that awesome? And those are little babies. So here, now we've got more sophisticated. We looked before, we saw the eye contact, the imitation. So now we've got actually initiating a game, Peekaboo. This little child's doing this. The little one on the upper left is the mom's clapping, and so is the little girl, or boy, I shouldn't. And here on the bottom one on the left is mom is making a gesture with her mouth, and the baby is doing the exact same thing. So all of these things should be happening by 9 months or later. If it's not by 9 months, and actually before then, you should be concerned. I mean, children can also be sick with something and have this, so I always make sure I find out history that they don't have other kinds of things, that they're just unhappy and not well. So imitation of gestures. Here's the lower right. It shouldn't say poor. The lower right is a very common thing, although, oh, it's a lower left on your side. Sorry about that. That actually we don't see anymore. We see this now. We sometimes have phones to ears, but it's very unusual now. There's a lot of swiping that goes on, and a lot of intense want of an iPhone. And that doesn't mean you have autism. It means you live in our world. And the top one, you can see the mommy and the child are doing back and forth. And the one reading the book, I just think that's fascinating. I mean, it tells you what a rich world this is for babies and parents. And parents notice when these things are not coming in. They kind of have some sense about this. And here's points. So, you know, there's actually different kinds of points. So there's the point of, I want it. Then there's a point of, oh, look. Point to show. And you can see in this one, mom's pointing. In the other one, they're both pointing actually up, and they're both looking up. So these are just nonverbal kinds of gestures. Pointing to show. And you can see, this little guy up there is really emphatic. And this is body language, facial. He has all this going for him. Like, go look, you know what he's saying when you look at that, don't you? And how do we know what he's saying? By looking at that, though. See, that's what's the issue. If you can't interpret that correctly, how do you respond correctly? And the other logo just talks about eye gaze. And there's another little guy who's pointing for something. So reciprocity, the top one, talk to me, I'm listening. These are all, you know, again, mom and the baby, and there's toys, and they're playing together. I'm really into pointing. Pointing is one of the things that I always ask about, and actually a lot of parents have figured out that this is something that can be part of autism. So lots of gestures. So here's examples of concerns, but just looking at that, you wouldn't say anything. Here's this kid going like this. Well, maybe she's in, listening to the circus and she's losing her mind with the noise. But if it's for a lot of things, it doesn't mean you have autism. You may have very acute hearing. The little guy is walking on his toes there. Toe walking doesn't mean you have autism, and it can run in families, but it can be part of autism. And this is the point. So parents will say, I don't think he can do this point. And I'll say, I think he can, but it's actually a social communication thing. It is not necessarily a motor gesture, it's actually social communication. So this guy's going, I want it, but not doing the very specific thing. And then the little child over on your right side is lining up things. I would tell you again, lining up things does not mean you have autism. If this is your primary interest in everything is lined up, that's an issue. And it's associated with other things. Red flags, then what? So you see some of these signs and you say, what do I do? Contact your pediatrician first. Pediatricians now are doing developmental surveillance, developmental screening. They're screening for autism also at 18 and 24 months. There's an instrument that can be used. So they are looking for this in practice, and if parents call up and say, I'm worried, they're very proactive, usually. So every visit when you go into the pediatrician, there should be asking about specifics at every visit. There's this test called the MCHAT, which is Childhood Autism Test, and actually it's also online. I now have parents coming in and telling me they scored it themselves, which we live in a world where people are well informed. It's scary though when you do stuff like that and then you're worried and it takes a while to get to see someone. MCHAT, again, is online, and there's actually an interactive screen that shows you actually what they're talking about on the MCHAT. So if you're unclear about the questions they're asking, Autism Speaks is an awesome resource. I use it a lot. There's lots of things that are in there that are very, very important things for parents. One of the things I use Autism Speaks a lot is for wandering, which is common in autism and some other disorders, meaning walking away and not responding. So these are kids who don't necessarily respond to their name, and something catches their eye and they're gone, and they don't respond to their name. And they love water, and a lot of young kids do, but this can get you into big trouble. And so Autism Speaks has an awesome piece there where they tell parents kind of things to do, because you can literally lose your child because they will wander off. Some, not all children do, but it's important that I think parents know that this can happen and that there's a resource that can help them out. So if they talk to the pediatrician and the screening is concerning, then they get referred for this full developmental autism evaluation. So this, if you see all these little things, I didn't want you to think, so this is babies over the age of 6 months. So again, the same proviso holds for this, that you can have a baby who has head lag at 6 months, and autism is not the reason. It could be a motor problem, it could be a lot of other things. If you notice right there, it says recommended for babies over the age of 6 months with a family history of autism, because the SIB study found this was pretty consistent finding for babies over 6 months that they would have a head lag. And I put all those notes in there so people don't go and just pull the baby up. Not that they'd hurt them, but it's more the result of the test can be influenced by what you're doing with the baby. And so there's all this: place the baby on his back on the floor, kneel over the baby, make eye contact, gently tug on the baby's arm, firmly but gently pull the baby by his arms to a sitting. If they're distracted, then you'd go over again. If he's looking about something else, And you can see the baby, obviously on the left, has head leg, and the baby on the right does not. It doesn't mean autism, but it is a sign that something might be going on. And this is fascinating. So this is eye gaze patterns, and we talked about eye contact and stuff. So they found that, you know, babies and kids with autism kind of look at you, but they're not always looking at your eyes. They have different eye gaze patterns. You can see on the one on A, they're looking at her mouth, they're looking at her fingers, and she's doing the same thing with another child who is glued to her eyes. And what's interesting about this is one of the tests that may be used at some point to be able to diagnose or get a clue about early diagnosis for children, because this happens very early, that there's eye gaze pattern changes, and if it is done with an eye gaze kind of machine. It's not somebody just doing this randomly. But if this could be something, this is non-invasive, non-intrusive. If this was something important, then we could go forward and have something that we could look at and figure out what kids need to get in really fast. So this is you seeing a child, or I'm seeing a child. And there's concerns about some of these things, but they pass the autism screen like in the pediatrician's office. I have to tell you, most of the pediatricians or doctors would still probably be referring on. One of the problems with workups for autism is it takes a lot of time and energy to do it. That's not a problem for the person doing it in a way, but it's based on behaviors, and behaviors change over time. And when you see children in a different setting than their homes, sometimes they look very different. So, and anybody who is doing autism evaluations is overloaded because of the numbers we just looked at. I mean, the whole systems have been impacted by the numbers of children coming through, and that's still continuing. That's why I think if we could have some markers early on that we'd really know who to hone in on and really get intensive intervention early, I think that would be optimal. Or if we could just prevent it, that would be even more optimal. So, repetitive behaviors, we talked about this can be normal, physiologic issues. So preemies who are pretty preemie, they actually use gaze aversion, looking away, to tell you, stop bugging me. And it's a cue that parents are many times taught in a newborn intensive care unit that, you know, the baby looking away at that point. But at the same time they're told that, they're also told your baby's at risk for autism. So it's kind of scary for parents because it is actually something that many very preemie babies do. It's kind of like the nervous system can't take anymore, so they just shut off for a bit. Further workup, so if kids do have autism, there are some more things that should be looked at. When I see children, I ask about sleep. In autism, sleep often is very, very disrupted, which causes problems for everyone. The child, the family, everybody in the household. It's very tough. For children who have sleep onset, meaning getting to sleep problems, there's actually been a couple of studies that have shown that melatonin, not forever use, but used for some time, can get kids into better sleep onset patterns. So that's actually really nice that there is something. The kids who wake in the middle of the night, we don't really have a lot more for them. The other thing that happens many times in autism is very, very restricted eating. It's kind of like the toddler diet continues, the white foods like pasta, rice, bread, etc. And it's not the best nutritional stuff, and they also have some sensory stuff, so they're very specific, some kids, about what they'll eat, what they won't eat. And therefore, you know, both sleep and nutrition are part of how you can function well in the world, so if both of those are kind of disrupted, it's very hard. I always ask about sleep apnea in children because it doesn't cause autism, but it can cause kids to kind of act out, have behavior issues, not do as well developmentally. It doesn't cause severe delays, but it just kind of, just like when we're sleep deprived, we don't do well, the same thing happens for them. Doesn't seem like it though. So if they do not pass the screen, then it's the formal testing. They should have a hearing test also. We do hearing tests at birth now, which is wonderful because now we can identify kids that have severe hearing problems right away where it would take a while before. So we know that was there. Other testing, so these are things that may happen. I don't tell people to do them necessarily. It kind of depends on, what history you get, your physical, their past history, thyroid, sleep apnea, metabolic. These are all some of these things. For most children, the standard of care is genetics, though. So it's these two tests. It's a chromosome microarray and a Fragile X to look for perhaps why they may have autism. And the microarray is the test that I talked about that can find these very small pieces of chromosomes that are different. So just to tell you what a diagnosis means, school, if they're in school, I get questionnaires from school, I get parent questionnaires, I do developmental testing, which can be very challenging because if you have a child who doesn't respond well, it's hard to know what they can do. I always tell parents for the first time when I see children, it's always probably going to be a low estimate of abilities because you can't tell what they can't do versus what they won't do. Of course, you can't tell that in anyone, but for these kids, this is important because they may have the ability, but they don't really care to show you. So the first time is tricky in terms of testing. I always do a play observation because it tells me a lot. So I have a wonderful playroom in all the locations where I work. I'm very fortunate. And I have a trampoline, I have a little house, I have a little slide, all kinds of kitchen stuff for pretend play. They can move around. And I would tell you that's where I kind of see what children may look like at home because they're much more comfortable and they can move. Young children don't do well in small offices. And I don't either, actually. And then the other part of the test is ADAS, and I use the ADAS too. There's obviously one before it. And it's very, very specific, and it's looking at those three areas with actually very specific toys. So I have bags of toys to test children. But they're the same that everyone uses, so there is this kind of standardization of how you're presenting it. It's very, very specific. And there's like 100 different things that you're supposed to be looking at. Valid, I told you, at 18 months. I also have I just think this is the most wonderful thing now to have home video clips. Usually parents have tons on their phones. It gives me an idea of what they're seeing at home because sometimes I see children who cry for at least the first half hour, unfortunately, even though I'm not doing anything and there's toys. It's just the change, that distress at small change. So having the perspective of what parents see, and I don't tell them just do videos of things they're concerned about. I also want to see play, communication, interaction. And this, to me, has been a huge difference because I see a lot of what they're talking about, and I see sometimes some other things. Intervention. So I said, we can get in there and we can do it. There's no one intervention that you do this, that's it. So the one that's out there that has been proven statistically is something called ABA, which is Applied Behavioral Analysis. Now, this doesn't mean we're trying to change bad behavior, like they're hitting their brother. This is not. This is behavior related to autism. It's attention, it's responsiveness. This is very statistically based intervention. They come into the home and they work one-to-one with a child for 2 to 4 hours a day, 5 days a week. Very intensive, very expensive. This is a statistical model, so it's easy to prove it's working versus some of the other interventions that I also like, but don't have this kind of heavy research behind them. And interventions, when I see a family, I look at the child. So when I see some children who are very, very rigid, I get actually concerned sometimes about using ABA because it can kind of feed into rigidity because it's very structured. I look at the family, and of course then I have who's going to pay if I'm recommending ABA or speech or occupational therapy. So I actually spend time with parents talking about each of these things. And I stay in contact with them during the beginning part of this by email so that, for instance, you can get family medical leave to set up this program. So that could be very important if both parents work or if they want, to have some more time at home with their child, because this is a lot of work to set up. So I try to get them access to services. Medical insurance covers some medical insurance covers ABA, not all. Recently, the federal government mandated that it be covered for children, but they've made it kind of a complex system to access. So for parents who have, for instance, Medi-Cal, it will take a lot more work to get them to get ABA, whereas before Medi-Cal did not cover this. So that's good that it covers. Some medical insurance, some companies do not cover ABA because they're self-funded or ERISA. So some big companies, they fund their own insurance and they were left out of this rule. But a lot of families do have medical insurance that will cover this. So I'm very happy that this has increased. This can also be covered by some state resources, the regional center, the school district. But getting people into these things and getting things going can take some time. And seeing someone who can help you with this takes time. So time is of the essence, and I've already told you it takes time to get in to see someone, so that's very annoying for parents and for me. Less likely to become firmly established, so we all know the longer you do a behavior and you want to stop it, the harder it is to try. Blooming and pruning, we talked about. Now, this is the other piece about autism diagnosis. So parents actually go through the same grieving process as a death. I mean, it's a different perspective. You didn't lose the child, you lose perhaps the dream for the child. And it implies differences in the whole family. And I'm there working with them, telling this diagnosis, and then I'm telling them all these things they have to do. And it's very hard for parents. I can tell you one of the things that helps many parents is doing all those things. Because if they have action happening, they feel empowered. But we all deal with grief in different ways. It's the same stages that Elizabeth Kubler-Ross wrote about a long time ago. They're still the same, and this is what happens. And some parents, some of us get stuck in a point, denying, anger. We're all different people. So I can tell you this is very hard for everybody concerned. So here's autism interventions. And it is pretty complex. Now it's gotten easier because if medical insurance covers it, I don't have to do all these other referrals. So the first part is programs, there's ABA. These are all types of intervention for autism. You don't do all of them at one time, though. Pivotal response, speech therapy, OT, social groups, the regional center, the school district, medical insurance. So, logistics. If I have an 18-month-old and I tell them they need 2 to 4 hours a day of intervention in their home, how about the nap? I mean, there's some stuff that really, like they need to sleep. You can't, and they should have some exposure to peers, typical peers. And sometimes I will suggest that parents decrease that a little bit in the beginning because, for instance, if they're not imitating right away, until they start imitating when they're with their peers, they're not imitating what their peers are doing. So you can shift that a little bit. Daycare, I mean, you have to have somebody home. What do you do? And then the financial part of this. Parents will say, oh, well, just pay for it. I'm like, no, don't pay for it. So lots of hoops to go through. Parent support. This is so important. There's family resources centers all over California and the United States. These are set up by parents who have children with special needs. These parents know they are boots on the ground and they know resources and they know how to help parents. By the way, I'm not just telling them a diagnosis, I'm telling them if they wanted more kids, they have a chance of it really is very, very hard doing this stuff. And I would then tell you, parents are very vulnerable. I'm telling them do this intervention, but nothing's been proven. I would love to say, do this, and it'll cure it. don't have it. And so parents look for other resources and maybe more alternative resources. I mean, as long as it doesn't harm their child and bankrupt them. I think going into it informed, like there's some folks I actually send people to who is actually a doctor here at UCSF, Dr. Newmark, that I frequently refer to if parents want to consider other options, because, by the way, 95% of them will do great gluten casein-free diet. And I don't have a problem with that, except if their child has restricted eating, they can basically have really bad problems in terms of nutrition. So that's when it's important to have a nutritionist involved if they decide to do it. Now, nobody has proven the gluten casein-free diet works medically, but parents say it does. So, and there may be some evidence. I actually ask, do you have problems with milk? Do you have problems with gluten? And everybody thinks they have problems with gluten today. So, and I actually do have celiac disease. I'm so happy. A lot of people think they have problems because now I have lots of things that I can eat. So this is important that you have some discussion if they want to pursue this, because there's some pretty strange kinds of very alternative things out there, like chelation for heavy metals that can actually kill your child. So, but there's other things out there that they can be looking at. And pediatricians, they should have a medical home. Their records should be there. Hopefully their pediatrician is able to coordinate a lot of this stuff for them and help them through the process also. So now I've gone through all this. These are some resources that I really think are pretty neat. The first one is the American Academy of Pediatrics. There's actually a resource toolkit for clinicians, like if pediatricians are saying, what if I'm in an area and I can't get anything? How can I help them with resources? How can I get things going? So this is something for them. The American Academy of Pediatrics and the Center for Disease Control and the Birth Defects Group put out an alarm sheet telling parents things that they should be looking at. There's an Ian site at Johns Hopkins, and this to me is where parents should go to look for research, other than Mind Institute. There's probably other places, but this to me is the site that really has some incredible information for parents. Autism Speaks, also the Thinking Person Guide to Autism is wonderful. A book for those of you, if you want to know more about this, 10 Things Every Child with Autism Wishes You Knew. And there's the Center for Disease Control, Learn the Signs, Act Early. So that was a lot of stuff to go through. Thank you.